As we start this new year, there's a lot on all of our to-do lists that should include taking care of our health. Dr. Mehra from SSM Health is here with the top 3 things that we need to know about our health in this new year. Good morning.
Good morning.
So this is a big thing. A lot of people, that's always their New Year's resolution.
How many of us don't even make a resolution now because it's basically become a joke? Either we know we're not going to go for it or we made the same resolution the past 10 years. So this is almost a reverse wish list. This is Dr. Mehra's wish list. These are things that I wish people would do for their health or ask their doctor, things like that. So number 1 is if you have a fear. So many of us have a fear. I'm overweight. My family member was diagnosed with cancer. I'm afraid I'm going to have multiple sclerosis. What about dementia? All these things. Whatever your fear is, talking to your doctor, saying, hey, doctor, whoever your doctor is, this is my concern, this is my fear for the future. How realistic is it that this is a fear for me, and what preventative steps can I do to really fight that fear that you have? That's the first thing. The second thing is preventative measures. So a lot of us are taking vitamins, a lot of us spend money on expensive vitamins, but how much are those vitamins really evidence-based? And number 2, what other measures can we take that are just good for our health? So there are a lot of preventative measures we can take that are life-saving, whether it's a test, whether it's a vaccine, whether it's other things that we can do, really talking to your doctor and say preventatively, what can I do to really save my life or just live the best life that I possibly can? And number 3 is, why am I taking this medicine? So many of us have a laundry list of medicines that we take either daily, weekly, monthly, but talking to your doctor and really understanding, why am I taking this? All too often patients will come in and say, here's the medicines I'm taking. And I'll say, well, why do you take this one? Why do you take this one? They're not as intuitive as you think, because many medications can have different indications. Someone may take it for blood pressure, another person may take that same medication for headaches. Really understanding why you're taking those medications and taking control of your health. So if I have one message for people this year, it's to really take control of your health. It's not to set unrealistic expectations or goals that eventually you won't keep. It's not to start a diet that's really trendy or a fad. It's really focusing on what your goals, your objectives are, and making a plan and putting that in place. So instead of dieting, for example, really saying, what are the healthy foods that I should be eating, and incorporating those healthy foods into your life. What are some of the favorite tips you have for New Year's?
Yeah, I think it's one of those things, trying to not put yourself out there as far as, you're mentioning, trying to do something that's too much for you.
Pushing yourself too far.
Sometimes just a little bit of a change can make all the difference, and I think that's where a lot of people fall off of the New Year's resolution by the end of January, because it's just not even feasible.
Exactly. So instead of setting that unrealistic expectation that I'm going to sign up for an expensive gym membership, I'm going to work out so hard, I'm going to lose 50 pounds, maybe just taking the steps every day at work instead of taking the elevator. So just those little changes will go really far.
All right, Dr. Mehra, Happy New Year.
Happy New Year. Happy Healthy New Year.
Yeah.